Our next speaker for today is graduated with a degree of Doctor of Medicine at the University of the Philippines, finished Urology training program at Philippine General Hospital, a Diplomate of the Philippine Board of Urology, Fellow of Philippine Urological Association and Philippine College of Surgeons, past National President of the Philippine Urological Association Incorporated, an examiner and the Chair of Philippine Board of Urology in 2020, an Associate Professor of Xavier University, Jose P. Rizal School of Medicine, the Medical Director of Maria Reyna Xavier University Hospital, past President of the Misamis Oriental Medical Society and Misamis Oriental Physician Nurses Foundation Incorporated, a member of the Cagayan de Oro City Local Health Board, and took units in Master in Science in Health and Hospital Management at the Xavier University 2013 to 2016. Let us now welcome our next speaker, Dr. RAUL WINSTON P. ANDUTAN.
Good day, everyone. First of all, I would like to thank the organizing committee for inviting me and including this very important topic, the student's path to become a urologist. I am tasked to showcase the practice of urology and inspire students to enter the exciting world of this surgical subspecialty. I believe that your idea of what a doctor does has also changed dramatically upon graduation from what you knew when you entered medical school. Many of the students now are at a loss as to what career path to choose from, hence this particular lecture. First thing first, what is the scope of urology? Well, traditionally, we define the scope by its anatomic boundaries. So, urology is a surgical subspecialty. That means urologists are surgeons. It deals with the diseases of the urinary system of both males and females, including the adrenals, and of the reproductive system of the males. Hence, it may be considered as the counterpart of nephrology in internal medicine, and it also overlaps with the practice of gynecology. But sometimes urology practitioners are not only defined by what procedures they perform, but rather by their lifestyle, by their associate and friends in life, or by their reputation. If the surgeon loves to travel, is family oriented, and does not have many surgical emergencies, but still with much luxuries in life, then most likely he is a urologist. What really attracts residents to the specialty? Well, urology is a very dynamic subspecialty because its advancement is intertwined with the progress in technology. The growth of medicine is best exemplified by the progress observed in urology. So, as surgeons, what procedures do we perform? Well, we are the pioneers in minimally invasive surgery, such as endoscopic surgeries and robotics. We started it all with our bread and butter procedure, the TURP, or transurethral resection of the prostate. Now, the landscape is rapidly changing, and TURP is being gradually replaced by laser prostatectomy for benign prostatic hyperplasia. The prostate inside a narrow pelvis is very ideal for robotic surgery. The reason why we are at the top as regards users of robot. In fact, about 70% of radical prostatectomies are done under robotics worldwide. Open surgery for kidney stones is also becoming obsolete with the advent of ESWL or extracorporeal shockwave lithotripsy, wherein we just fragment kidney stones with sound waves. And if ever we cannot fragment with ESWL, we do percutaneous puncture of the kidney under ultrasound or fluoroscopic guidance. Then do fragmentation with laser or other sources of energy. Likewise, radical and partial nephrectomies are now commonly done laparoscopically. So it seems that urologists have it all. Urology is a world of exciting procedures. And if you are so daring and adventurous, you can go into SRS or sex reassignment surgeries. Or you may specialize on penile implants. You may also opt to focus on kidney transplantation, where you can do the harvesting of kidneys through laparoscopic procedure or open surgery. If ever you wish to perform the anastomosis of the renal to the iliac vessels, then you have to undergo additional formal transplant fellowship training. You may also concentrate in pediatric urology to repair hypospadias and vesicoureteral reflux. You have a spectrum of procedures to choose from. You may wonder since when urology has been practiced. Well, the interest in urology as well as its practice is as old as the time of Plato and Hippocrates in around 300 to 400 BC, as documented by Aristotle in his treatise Definitiones Medicales. However, our national organization is relatively young, which was founded only in 1957. Currently, we are 431 members nationwide, with the majority, around 60 to 70%, are practicing in National Capital Region. In 2003, the first ever chapter of the Philippine Urological Association was created, and it is the PUA Mindanao chapter. Now there are 6 chapters of the association nationwide. The Mindanao chapter has 45 proud members, and I am privileged to mention that the chapter has produced 2 national PUA presidents. To maintain the highest standards of residency training programs, the Philippine Urological Association established in 1972 its independent accrediting and certifying arm, the Philippine Board of Urology Incorporated. It is responsible for monitoring compliance with the standards and certification of core competencies of the graduates. The need for urologists in the country may interest everyone. If we translate the 431 members as of 2021, to urologist to population ratio, every Filipino urologist is handling a population of 250,000, a far cry from the ideal 1 is to 20,000 ratio. In Mindanao, which counts for about one-fourth of the total population of the country, the ratio of urologists to population is as high as 1 is to 600,000. Hence, there is a big demand for urologists, especially in Mindanao. So, what academic background does urology residency require from you? It is not so much of your initial medical knowledge after graduation that will guarantee the success of your future clinical practice, but rather from what you will learn during your residency training program. Although a strong background in anatomy, physiology, and pathology may help. The four basic core competencies that are expected to be acquired by every graduate are medical knowledge, surgical motor skill, focused on minimally invasive procedures, communication skill with your patients and colleagues, and lastly, professionalism. The core competencies are expected to be translated to the basic attributes of being a Filipino urologist. The graduate must be a competent and safe clinician, possessing a defined body of knowledge and procedural skills, who is able to make appropriate clinical decisions. As a leader, we must be able to handle positions in organizations, be it in the hospital or professional one. As a communicator, he or she must be able to establish relationship with patients and colleagues. And as a team player, he or she must be able to collaborate with a multidisciplinary team and recognize the importance of this approach of patient care. As an academic, he or she must be able to recognize the need for continuous learning. As a professional, he or she must be an ethical practitioner. And as a health advocate, he or she must be able to contribute to improve health systems. The entire training in general urology consists of 1 to 2 years in general surgery and additional 4 to 5 years in general urology proper. There are now two institutions which have implemented the 1+5 program, meaning 1 year of general surgery instead of two, and 5 years of general urology. This is to focus more on minimally invasive procedures. And where do you wish to train? Well, entry to general urology residency has become very competitive. Currently, there are 11 Philippine Board of Urology accredited training programs and 3 Philippine Board of Urology recognized training programs. The latter refer to a structured program without accreditation yet. A requirement for application for eventual accredited training program. Our very own Northern Mindanao Medical Center in Cagayan de Oro City has just applied for recognition and is scheduled for inspection in December this year. The 11 accredited institutions are producing 20 to 25 graduates per year. So where in NCR? Well, in NCR, UPPGH is still the premier institution, but the other training institutions are fast catching up. The various institutions have their own respective strengths, like UPPGH with its high volume and variety of cases, and is the only government institution with a robot. NKTI, or the National Kidney Transplant Institute, has its transplant exposure, and laparoscopic and endourology as advantages. UST, on the other hand, has pediatric urology and urodynamics as its forte. East Avenue Medical Center has endourology and laparoscopic surgery, plus rotation in Vietnam as advantages. Uh, Jose Reyes Memorial Medical Center has also the variety in volume of cases as its strengths. Veterans Medical Center has TURP as its strong point. How about training programs in the provinces? We have two each in Luzon, Visayas, and Mindanao. Vicente Soto Memorial Medical Center in Cebu has its first graduate here with us in Cagayan de Oro. Likewise, the training officer of the soon-to-be-recognized program in Northern Mindanao Medical Center is also with us. Presently, SPMC, or the Southern Philippines Medical Center, where the majority of its consultant staff are NKTI trained, is the nearest accredited training institution to Cagayan de Oro City. The Philippine Board of Urology encourages collaboration among training programs to complement each other. So you can choose anyone because they are now almost equal. They have their respective strengths. How do you become board eligible, which is defined as being able to take the certifying Diplomate exams? Well, you must have trained for at least 6 cumulative years, inclusive of general surgery, all in accredited training institutions. You must have complied with the required number of cases and research papers. Equally important is you must have passed the basic and clinical resident and service exams, as well as the practical TURP exam. The latter is given to graduating residents who have complied with the required number of TURP cases. The Philippine Board of Urology is not only concerned about the clinical competence of the graduates, it likewise puts much emphasis on the ethical competence, and attendance in seminar on professionalism is mandatory prior to conferment of diplomate status. Once you have become a diplomate of the Philippine Board of Urology and you wish additional training, you may decide to undergo fellowship training in any of the popular subspecialty fields. Well, NKTI offers Urologic Oncology Fellowship, while East Avenue Medical Center offers fellowship in endourology for stones. Well, to all interested students, I advise you to grab the opportunity to be famous and respected, pursue a clinical practice where you can enjoy a full life. So I advocate, I advise that everyone, every student, or most of the student or top of your class students join the urology family. Thank you for your attention.